Nutritional secondary hyperparathyroidism, or more commonly known as bighead, is a disease that affects the bone growth of horses that are exposed to subtropical grasses that contain oxalate. Bighead in Horses, Not an Ancient Disease, written by Jennifer Stewart, Oliver Liu, and Gary Wilson, and published in volume 29 of the Australian Equine Veterinarian, is a study that aims to focus on nutritional secondary hyperparathyroidism, or NSH, occurring in horses in Australia grazing subtropical pastures, with particular emphasis on the oxalate-containing pastures. NSH is an excessive production of the hormones produced by the parathyroid gland caused by the dietary imbalance of calcium and phosphorus. Hypocalcemia prompts the increased activity of the parathyroid gland, and diets containing high phosphorus and low calcium, or a ratio of calcium to phosphorus less than 1:1, will cause NSH. In situations where calcium levels are low, the body will maintain equilibrium by dragging calcium from bones of the horse to ingest into the blood system. Certain grasses contain a high content of oxalate, which bind to the ingested calcium in the horse, forming what is known as calcium oxalate. This makes the calcium insoluble in the equine diet. Grasses containing more than 0.5% oxalate or a calcium oxalate ratio of less than 0.5 result in a negative calcium diet. NSH is frequently seen on the eastern side of Australia and in particular central Queensland, where large amounts of brigalow country have been developed and replaced with introduced subtropical species such as buffle, pangola, green panic, signal, and purple pigeon grass. Equine diets with a 1% oxalate content reduce the calcium absorption within the equine digestive system by 66%, and in the right conditions, grasses can contain as much as 6% oxalate, which has the ability to bind all calcium content in the grass. Most NSH cases occur in spring and summer, with delayed signs of calcium deficiency for as long as 2 to 8 months after the introduction to the high oxalate pastures. Young horses, pregnant and lactating mares being the most susceptible to this. 3 classified clinical signs of NSH include ill thrift, lameness, and swelling of facial bones. The first sign of NSH are usually intermittent shifting lameness resulting from articular cartilage erosions. However, in most prolonged cases of NSH, swelling most notable in the skull bones, jaw, maxilla, mandible, and nasal bones, which is where the more commonly known name of bighead is derived. Bone growth is due to the demineralized bone growing large amounts of fibrous spongy tissue that are attempting to compensate the strength of the original bone. As the increase of spongy bone tissue is developed, problems with mastication can occur, with difficulty chewing and dental pain, which can cause to decrease food intake, resulting in a loss of body condition, and in advanced cases can lead to teeth beginning to separate from the upper and lower jaws. Due to the slow development of this disease and the horse's ability to adapt to the initial side effects, NSH can generally go unnoticed until even more severe side effects are shown. In summary, although this is a cruel disease with severe outcomes, it can be easily treated by either immediately removing the horse from the area with high oxalate, or alternatively, correcting the dietary imbalance while adding a chelated, high calcium supplement daily. This can lead to minimal retention and the potential reverse to the side effects of NSH.